What is it that, you know, those that are over the age of 65, in that, what should we know about this? And specifically to that really small group that experience a much higher, you know, rate of an acute reaction?
These are great questions. So age is interesting, if you look at the average age of death and this current pandemic as we track it, northern Italy is 6 to 8 years older than southern Italy, and it's one of the oldest countries in the world. Its average age is around 49 years of age. The United States and China are about 36 years of age. So we're 13 years younger as a population. And so when you see the United States having the highest death toll from this thing anywhere else in the world now, you need to ask, what is going on with the United States? Why is the United States apparently older biologically than it is chronologically? Why is China at the same average age, or many European countries similar age to our country? Why are we dying more? And the answer is pretty obvious. When you rank in chronic disease or health outcomes, everything from neonatal death all the way to end of life things, the United States ranks 35th in the world by the most friendly measurements from the government. Watchdog organizations think that we might rank closer to 46th or something in the world. But we're somewhere between 35th and 49th in the world.
So we're at the tail end of all modern societies. We're
at the very bottom of
the list.
So if you look at the top economies and industrialized nations, we're dead last of health outcomes. And so why is the United States dying, and why do we have so many examples of younger people dying? It's because we are sicker than any other nation. And so specific to this COVID, it turns out that we know that the coronavirus, both the common cold as well as these more severe versions of it in SARS, MERS, and COVID, binds to a receptor in the lung that's called ACE2. And so this ACE2 receptor is expressed naturally on our lung surfaces. As we age, ACE2 can go up, especially if there's respiratory disease. So COPD, for example, has very high ACE2 expression along the surface. We have lots of channels in. And COPD is one of the only lung conditions that puts you at increased risk of death from this. All the rest of them are vascular, right? It's cardiovascular, renal disease, coronary disease, and cerebrovascular disease. These can end diabetes and the like. If you look at those comorbidities that people are dying from and their relationship to this ACE2 receptor, it gets pretty interesting, because ACE2 goes up naturally in lung tissue from damage from emphysema type things with COPD, but not in cardiovascular disease until you add 2 drugs. And so when you add a statin drug, suddenly the whole system upregulates ACE2 receptors. When you add an ACE inhibitor, which is our leading #1 recommendation from all medical societies, if you have diabetes, heart disease, or chronic kidney disease, the first drug you're supposed to be on, and you can get sued for malpractice if you don't have a patient on one of these drugs, is an ACE inhibitor. If they don't tolerate an ACE inhibitor, the most common side effect of ACE inhibitors is cough, because you've upregulated the ACE2 in their lungs, and now they're reacting to their environment abnormally. So if they develop an ACE inhibitor cough, which means you've changed the balance of their reactivity to their environment, then you need to put them on an ARB, which is an angiotensin receptor blocker, which again upregulates ACE2 receptors. And so ACE inhibitors and ARBs are now seen to be a major risk factor for death from COVID. Why? Because it upregulates the ACE2 receptor. And so the United States is the most medicalized system. So yes, we have high chronic disease rates, and in response to those chronic diseases, we put on medications that we know are putting you at risk of dying from coronavirus. So if we had a true public health organization that was really concerned about the next few months of death from a coronavirus that just got discovered over in Wuhan province, the very first thing we should have done is announce, doctors, you need to transition all your patients who are on ACE inhibitors over a calcium channel blocker or some other form of blood pressure control, or hey, maybe put them on a healthy diet. But regardless, take them off the ACE inhibitor. If we had done that, we would have saved thousands of lives. Take them off the statin, There's no, the absolute risk of dying from a heart attack by taking somebody off a statin is near zero for a 3 month, 6 month period. And so take them off of their statin, put them on a healthy plant-based diet so their cholesterol doesn't go up, and then take them off their ACE inhibitor. If we had done that, we would have completely changed the death toll in the United States. We knew that these drugs increase ACE2, and we knew, based on SARS, MERS, and the common cold corona, that it binds the ACE2 receptor. If we had done that, we would have saved thousands of lives all over the country, not to mention all over the world. And then we should have stopped influenza vaccination, because an extraordinary study came out in 2017 showing that if we vaccinate for flu, your risk of getting coronavirus the following year goes up. And this is not just corona, but 6 other common respiratory viruses, their risk goes up. And this is commonly seen. This is a well-described scientific phenomenon, that if you get exposed to the real influenza, you develop what's called kind of this transverse immunity, where you get immunity to bugs that aren't even represented in influenza. You get this immune system intelligence, and you will now become resistant to other bugs. If you don't get flu and you're exposed to an abnormal protein within that flu virus, and so you have to mount a weird antibody to that, so you can't get your normal herd type or kind of immune system response to the environment, then you get increased risk of this. So what we should have done is, if we really believed that this thing was 10 times more deadly than flu, well, actually they said at the beginning it was 100 times more deadly than flu.
Right.
If they really believed that, then in December they should have frozen all influenza vaccines. Said no more influenza vaccines, come off your ACE inhibitor and your ARB and your statin drug. Don't get influenza vaccine. We're going to cruise through this season because we have a new strain. We didn't do any of those things. We know that science. NIH knows that science. CDC knows that science. We did not make public health moves to protect the community from coronavirus. Why? I think we kind of knew. Well, I knew right away, just because I have a calculator. Anybody with a calculator, as soon as the first cruise ship stopped in Oakland, we knew everything we needed to know about this virus. That nobody died on that ship. For 14 days, they were quarantined on that ship. It has a 5-day infectious period. You will develop symptoms in 5 days if you're going to develop symptoms at all. And so we should have seen high amounts of blue people and liver failure and all of that on that ship, because it was the worst population you could possibly isolate, because they had an average age over 70 on that ship, and there were children running around. So you've got children, which are the best microbiome swappers outside of dogs. Dogs are definitely our best, but kids are this awesome gift that they're so good at microbial communication. And so you've got kids running around the ship. You've got old people. They're sequestered, and they didn't sequester. They didn't quarantine those patients away from each other in those initial couple of weeks. And so it should have been massive death toll on that ship, and yet nobody was even critically. I think 1 or 2 people came off critically ill. The rest of the 3,700 people weren't even. There was only 100 or so that were showing symptoms at the end of the 14 days. A few people weeks later died, and we said they died of coronavirus. Coronavirus was definitely in their experience. It was present. May have contributed in some way, unmasking toxicity of their statin drugs and their ACE inhibitors and their flu vaccine that they got. But ultimately, we knew that the death toll on that ship was low enough that if we extrapolate over the United States, we would see somewhere around a death toll of 0.1%, maybe 0.3% at worst. And we know that flu can, in 2017 was causing a 7% mortality rate. So we knew at the beginning that this was not going to be some massively fatal thing unless we managed it wrong, and we did.
If you like that clip, then be sure to check out our live broadcast of the HighWire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, YouTube, iTunes, and Twitter. We'll see you there.